Are there any care managers or case managers here today? Just one?
No, there's more.
There's more. You guys are invaluable to your agencies, you're invaluable to your clients, and you're going to be very invaluable to the treatment of depression. We need you. Here's a generic, middle-of-the-road definition of what case management is. There are some that are a lot more generic. There are some that are a lot more clinical. But does this speak to what anybody does on a daily basis? In our model of collaborative practice, we want to include the patient, the social worker, the nurses, the community, if necessary, support systems, and encompass and communicate along the way with all the other care providers. It's a method of providing services whereby a case manager assesses the needs of the client, arranges, coordinates, monitors, links, and advocates for a package of services for the patient. Does anybody do that every day?
Yes.
It's not easy, is it?
No.
We all develop ways of doing things that work for where we are. And that's okay. We're not trying to change that. We're not trying to burden you with some extra work. Key components, engagement, very important. Anybody ever heard I'm not depressed before from their clients? I don't have a substance abuse problem. I don't beat my children. It's very important to build rapport, engage the patient or the client, and get them to open up so we can help them. Linkage. If we can't provide services ourselves, we know the resources on where to get them. They may not always be available, but we continue to try to link them to the services that they need. We follow up and monitor, and most of all, we advocate for what the patient may need. The goal is multifaceted, includes achievement of optimal health, access to care, appropriate utilization of resources, and a balanced patient's rights of self-determination. In our model, what we're hoping to do is support the patient's ability to develop a wellness plan and become a partner in their own care. Follow up with their care and sort of support them in their self-care. No one knows a patient better than the patient, right?
Yeah.
We may think or we may believe we understand what motivates them. But we don't necessarily know. Because people will tell you, oh, I'm taking my medication, but they're not. Well, why? Well, part of what we do is we try to understand that. But the patient is the expert. As case managers, we recognize that fact. So we want to marshal that patient to sort of motivate themselves with our assistants and the team, the doctor, the psychiatrist, the psychologist, for wellness and to beat depression.